the golden hour, the first 60 minutes after a shooting, when surgeons have the best chance to save a life.
A patient who is coming through the trauma bay as a trauma surgeon, I have to presume that they're here because they're bleeding to death.
Chief Trauma Surgeon Dr. Josh Hazelton has only had minutes to diagnose and operate.
The patient may literally be dying right here.
At the end of the table, Dr. Josh Hazelton.
WellSpan medical staff held this press conference highlighting the recovery of York County Sheriff's Deputy Lieutenant David Godfrey.
Upon arrival to the trauma bay, Lieutenant Godfrey was unstable and, as I said, bleeding to death. His injuries were life-threatening. He was awake at the time and speaking to the trauma team.
Godfrey was treated here, nearly dead, shot multiple times in the torso, abdomen, and legs. The same attack killed 3 detectives and injured another.
So that pager goes off, and the trauma patient will come down the hallway from the ambulance bay, and they will come through this room. And what they'll find when they come through this room is they will be met with a team of typically around 20 people.
There's a lot of teamwork and a lot of cross-communication.
WellSpan Emergency Department nurse Kim Godfrey and trauma surgical ICU nurse Lindsay Ritchie were both on Lieutenant Godfrey's surgical team.
You get that little heightened sense of a butterfly reaction in your stomach and your chest, but you have to stay centered.
It's an adrenaline rush with a little bit of anxiety. We consider them family, and we will do our best to make sure they get home to their families.
Yep.
Both nurses are married to first responders, so treating a critically injured officer in the trauma bay struck a personal chord for them.
I've cried, I've shed tears, you feel all the feels knowing that it could have been him.
The day of the shooting, Lindsay didn't leave the hospital until after midnight. Her husband waited up to make sure she was okay. That next morning, her son asked,
"Did you help anybody, Mommy? Did you save anybody?" And he gave me a hug, and I just said I was glad I was able to help them.
Yeah, they saved a life that day. So Dr. Hazelton said if there are any lessons learned from that incident for them, it's that their team is ready. So there are 2 advancements I want to talk about that are also helping to save lives. It actually happens before patients get to the trauma bay. So police officers and EMS on the ground, the people you met yesterday, they can now put tourniquets and stabilizers on a victim. The other one is the ability for medics to carry and transfuse blood. That's buying critical minutes surgeons need, and those things are certainly the reason why Lieutenant Godfrey is here today. In fact, we would like to share a message from him.
From a first-hand perspective, I can tell you, watching every individual section and element of this process, they performed flawlessly and excellent. I can't thank them enough for everything they did for me, for saving me, and for putting me back to recovery, hopefully at 100%.
After 16 days in the hospital, Lieutenant David Godfrey moved to rehab. He went from unable to walk to leaving the center without any help. So tonight at 11, we'll hear from his rehab doctors and also his therapist. Just a remarkable journey. And also, we are very excited to announce an upcoming exclusive project we're working on with Lieutenant Godfrey. We'll share more of those details soon. But also, the main question that I found out, guys, was his favorite Thanksgiving side dish.
Okay.
Can you guess what it is? It's stuffing, but not just any stuffing, homemade from scratch.
Ooh.
Yeah.
Isn't all stuffing made from homemade from
No,
scratch?
not mine.
Well, mine
Oh,
is.
believe me, if there's a way to do it, that's the way I would do it. Not make it from scratch.
That's
So
true.
I'm sure it can be
You
done.
can make it from
no, absolutely.
the box or
yeah.
whatever.
But
yeah,
it's been
I've only
such a-
known the homemade kind.
Yeah, but it's been such an honor to go through and to meet all these individuals.